Clear?
Back in sinus.
D-dimer. What are you doing?
1 gram calcium glutamate, IV push.
We don't have the labs back.
Click the monitor. Widen QRS and peak T waves, hyperkalemia.
All right, so here is a good cardiac arrest scene here, and I really do like this scene. And so here you can see that the physician, he is trying to make the clinical diagnosis of hyperkalemia along with rhabdomyolysis based off the clinical scenario, what's going on right now, and the history of the patient given he just ran a triathlon. And then the first drug that he reached for to treat the suspicion of hyperkalemia is calcium. Okay, notice that he said calcium gluconate. Now, calcium comes in several different forms. They can come in calcium carbonate, calcium gluconate, calcium acetate, and then calcium chloride. So calcium has so many different salt forms, but he specifically chose calcium gluconate. And this is important. I don't like this scene just for the dosing reasons, simply because this is a cardiac arrest patient because of his likely hyperkalemia, because of the peak T waves on the EKG. But the reason why I don't like it because it's slightly not accurate, right? It's slightly off. And the reason is because typically in a crash cart, it's calcium chloride that's giving, not calcium gluconate. Now, he maybe was like in the heat of the moment while shooting this scene and just forgot to say calcium chloride. Instead, he said calcium gluconate. And then he said 1 gram calcium gluconate. Now, to a patient who is not in cardiac arrest, right, 1 gram calcium gluconate will be sufficient enough. But in this specific case, this patient is obviously unstable and he just had a cardiac arrest. And so typically in a crash cart consists of calcium chloride in a readily available syringe. It's usually 10% calcium chloride in a 10 milliliter syringe.